Welcome everybody, and thank you for coming to the Cook County Health and Hospital System celebration of World Kidney Day. We're glad everybody could make it, particularly with the rotten traffic outside. We've got a couple of folks who are going to be a little bit late. My name is Dr. Jay Shannon. I'm the Chief of Clinical Integration for the health system, and I'll be the interim CEO when Dr. Raju leaves. Before we get started, I just wanted to recognize some of our guests and dignitaries who are with us today. We've got en route Commissioner Bobby Steele, Robert Steele, sorry. Yeah, that's Bobby's the mom, right? Okay, we've got Commissioner Robert Steele en route, and he'll be speaking with us this morning. I believe we have Nicole Harvey here in place of Representative Danny Davis. We have also Representative Elizabeth Hernandez. We've got Dr. Goyle, who's the Medical Director of Illinois HFS. We're grateful that he could come. Kevin Smunt, Dave Bosch, and Reza Mendoza from Gift of Hope. We're grateful for you being here today. Warren Ribley is here from the Illinois Medical District Commission. He's also here with John Collins and Heather Tarzan. And who have I missed? Have I missed anybody? I think that's it. But anyway, we're glad that you're all here. This is an important event as we increasingly recognize the burden not only on the economy, but more importantly on patients' lives of kidney disease. It's important now that we've got, particularly important now that with the passage of the Affordable Care Act and improved access to care for patients, that as we start to think as an organization around population health, that we recognize the important contribution that healthy kidneys have on a healthy population, and we're happy to support that here. The other thing that I would just note before turning it over to people who are a lot smarter about kidney disease than I am, is that this kind of an event, this kind of a day, really symbolizes the importance of collaboration. A health system by itself doesn't do it. We need to collaborate with our partners who are payers. We need to collaborate with local philanthropy. We need to collaborate with people like the IMDC who can help us to try and find ways that working together we're more effective than we are working individually. So we're grateful that everyone's here, and I'm particularly happy to introduce our Executive Medical Director, Dr. Claudia Fagan, who will give us a few more words, and I'll drop the mic here for you.
Thank you very much.
Oh, I'm sorry.
Okay. Thank you very much, Jay. So we're happy to be here to celebrate National Kidney Foundation Day. And it's really our commitment to preventive services why we're partnering. This is our second time partnering with the National Kidney Foundation. And our goal here is to increase public awareness and really try to increase the awareness about among people who are most risk for kidney disease, and that happens to be a lot of the patients that we serve in the Cook County Health and Hospital System. It's because thousands of our patients, just like millions of Americans, are really unaware of the presence of kidney disease. And they may have untreated high blood pressure, untreated diabetes, or not adequately treated, or even have a family history of kidney disease, not aware of it. And so unfortunately, most of the time they present very late. The purpose of days like today is to screen people early so because of our attention to preventive services, that we can intervene in positive ways and preserve people's kidneys. Our physicians who work here in the health system are really known throughout the world for our strong clinical practice, but we're also known for our commitment to not just our patients, but the communities from which our patients come. And so events like this are meant to better serve the communities we serve. Our kidney team, led by our chairman of the Department of Nephrology, Dr. Peter Hart, has provide service to thousands of patients who would not have access to care otherwise. In the past year, they had over 1,200 new patient visits for patients with kidney disease, over 8,700 follow-up visits, and they performed over 1,000 medical consults on patients with kidney disease. Despite these efforts to intervene and preserve kidneys, many of our patients present only when they are in need of urgent dialysis. In 2013, we gave over 5,600 dialysis treatments to patients, 1,700 inpatients, and nearly 4,000 outpatients. So our goal today is to try to reach out, have patients screened, and treat them before they need dialysis, and maybe prevent that need for dialysis and prevent that kidney failure. It's my honor really to introduce one of our patients, Mr. James Moore. Mr. Moore.
Good morning. How you guys doing today? Like she said, I'm James Moore. I'm a patient here of the dialysis unit on the second floor. What happened to me is I started experiencing shortness of breath, nausea. I was very sick. I was very slow. After a couple weeks, I came to the emergency room. I was admitted. I met my doctor, Dr. Joshi. He's a pretty good guy. He's very helpful. The nurses up there are great. I started taking dialysis. I feel a lot better. Some of the things I did to change my lifestyle: no salt, no sugar, exercise, and that's mainly what I did. Thank you very much.
We're waiting for Commissioner Steele, so I will go next. Dr. Shannon, Dr. Fagan, Dr. Hart, colleagues, volunteers, participants, honored guests, good morning. My name is Tipu Puri. I'm a kidney specialist at the University of Chicago and the current chairperson of the Professional Advisory Board of the National Kidney Foundation of Illinois. On behalf of the members of the Professional Advisory Board, let me add our welcome and enthusiastic support for this World Kidney Day event. I'm also here today as a World Kidney Day champion. World Kidney Day has been held annually on the second Thursday of March since 2006. You might be asking, why is it important to have World Kidney Day? Dr. Fagan touched on this a little bit, but let me expand if I may. What is the purpose? The mission of World Kidney Day is to raise awareness of the importance of our kidneys to our overall health and to reduce the frequency and impact of kidney disease and its associated health problems worldwide. That's from their website. Put simply, World Kidney Day is about starting conversations within groups, within families, between people and their doctors. When someone has chest pain, they talk to their doctor about whether they might have heart problems. When someone is short of breath, they talk to their doctor about whether they might need to see a lung specialist. What symptoms make someone talk to the doctor about whether they have kidney problems? The fact is that early kidney disease has virtually no signs or symptoms, and many people don't know that they should talk to their doctor about kidney problems. That's scary because we know that 1 out of 3 American adults is at high risk for kidney disease. And 26 million American adults are living with kidney disease, and many don't know. If you have diabetes, you should talk to your doctor about kidney disease. If you have high blood pressure, you should talk to your doctor about kidney disease. Why? Because diabetes and high blood pressure are the 2 leading causes of kidney disease and account for nearly 3 out of every 4 patients that go on to require dialysis due to kidney failure. Awareness and education is so important. It is key. With awareness and education, we can diagnose kidney disease earlier. With awareness and education, we can often slow kidney disease with aggressive treatment. With awareness and education, we hope to prevent kidney failure. Awareness and education is what this World Kidney Day event and so many of the other programs of the National Kidney Foundation of Illinois are all about. I thank you all for being here today and hope that you all, volunteers, participants, physicians alike, continue the conversations when you leave here today with family, with friends, with your doctors, and then encourage them to do the same. I'd like to take a moment now and welcome Ann Black, Chief Executive Officer of the National Kidney Foundation, up to the podium to tell you a little bit more.
Thank you, Dr. Puri. And thank you so much to all of you for being here this morning. It's a wonderful show of support, not only of the National Kidney Foundation of Illinois and World Kidney Day, but of the partnership that we have here with Stroger Hospital and the screening that we're doing downstairs in the cafeteria at about 10 o'clock. I want to thank the sponsors of this wonderful day. I'd like to thank DaVita, Gift of Hope Organ and Tissue Donor Network, Next Stage, Fresenius Medical Care, and the University of Chicago Medicine. I'd also like to thank the Illinois Medical District for their promotion and support of this wonderful screening event. And lastly, I'd like to thank John H. Stroger Jr. Hospital of Cook County for hosting this event, providing the space, promoting it, and sharing the importance of World Kidney Day with their patients, with their staff, and with people in the community. As Dr. Puri talked about, the National Kidney Foundation of Illinois provides these free screenings because we know how important it is to stop kidney disease in its progression. 1 in 3 American adults is at risk for chronic kidney disease, and we know that we can stop that if we catch it early enough. So I hope that you'll join me and Dr. Puri downstairs at the screening for a tour of the different stations that we have, and see the importance of what it is that we're doing throughout the year, and not just on World Kidney Day. We have screenings all through March, from March to November. And then I hope you'll take a chance to go outside and look at our Kidney Mobile, which is an educational exhibit that people can learn a little bit more about what the kidneys do and the foods that you should avoid if you want to avoid kidney disease, high blood pressure, and diabetes. Thank you so much for being here today.
World Kidney Day event is a big screening to help identify and educate people with kidney disease. So many people don't know that they have kidney disease. And kidney disease is caused by diabetes and high blood pressure, which are very common diseases amongst many people. And we know that 1 out of every 3 American adults are at risk for kidney disease, largely because they may have diabetes or high blood pressure. And they have no idea that diabetes and high blood pressure are causing damage to their kidneys. There are no symptoms or signs early in kidney disease, and unless you get a blood test or a urine test and talk to your doctor about getting screened, many people will go on not knowing that they have kidney disease. Kidney disease screening is painless. It's a urine test, it's a simple blood test, and once you know that you have kidney disease, you have an opportunity to take control, to maybe control your diabetes a little better, to control your blood pressure better, to work with your doctor, and hopefully prevent kidney disease from getting worse. We know that those sorts of strategies, controlling diabetes, controlling high blood pressure, and certain medications can help slow down kidney disease and maybe even prevent kidney failure, which is the biggest reason why people go on dialysis.